We need to check.
Yeah, the new administrator, yeah. And there's a differentiation between me and that. He looks great.
Not finish your journal entry? No? I don't know if this is necessary, but we're going to use it anyways. My friends, I want to call this City of Saline Health and Wellness Forum to order a few minutes after 9 p.m. on February the 11th. Say again? AM, excuse me. My apologies. Thank you, Councilman Seo. A few housekeeping things this morning. One, I want to thank all of you who are a part of this discussion this morning. Appreciate you taking time out of your schedules to be with us. Those of you who are in the audience this evening, we appreciate your participation and attendance as well. The health and well-being of this community is of paramount importance, and we appreciate your interest in this issue. Those of you at the dais and those of you who are in the audience, you should have all received or picked up an agenda for this morning's meeting when you came in. If you did not, there are some extra tables, extra copies on the table to my right. You may pick them up at your leisure. We would also ask that those of you who are in attendance this morning and are part of the audience that you sign in. There's a sign-in sheet. And I believe the sign-in sheet asks for your name, your address, and your email address. And we would welcome and encourage you to sign in so that we can stay in touch with you on these important issues and others. We are going to have two public comment periods, one that will commence in just a moment. These public comment periods will limit each speaker to no more than 3 minutes. We would welcome you to come forward to the podium and speak at the microphone, so that everyone in the audience, as well as those of us at the dais, can hear what you have to say. And we would welcome your questions, your concerns, but more importantly, your ideas for the future and how we can meet this community's healthcare needs moving forward. I also want to apologize for something of an awkward setup. The podium directly in front of me is wired from the basement and really cannot be moved. So it's been slightly pivoted from the position it occupies during a normal council meeting, and that's why we're at the angle that we're at. So if it's awkward to anybody, I apologize, but of course this room was designed for council meetings, not for discussions of this nature. So with that, we come to our first comment period, and I'm going to read the verbiage here, which is pretty much verbatim to what we have at a council meeting or any public board or commission. At this time, we will entertain comments from the public. Comments will be limited to 3 minutes per person. Anyone who would like to speak is requested, but not required, to state his or her name and address for the record. We would appreciate it if you focus your comments on how this community can meet our future health care and wellness needs. Are there any citizen comments or public comments? Okay. Well, again, you'll have an opportunity to speak at the end of the meeting if that is your wish. So we will proceed with the discussion portion of our agenda this morning. Again, I want to thank everyone for their attendance. Clearly, this community's well-being, specifically relating to health care, wellness, long-term care, mental health, is of paramount importance. Access to quality services and amenities is not just a privilege that should be afforded to the few, but it is a right that should be offered to all of us. And so the genesis and impetus for today's meeting was to gather all decision makers and community stakeholders who have an impact on health and wellness issues around a table, to have an open dialogue and discussion about what is the state of health care and wellness in the Saline community to date, what are some trends and issues that we need to be cognizant and aware of moving forward, and how can we as community leaders best meet the needs of those who we represent. So at this time, we're going to work our way around the table and do some introductions. I guess I'd ask that this time, if you want to limit your comments to just a minute or two, acknowledge who you are, the organization that you're representing. Once that's concluded, we'll work our way around the table again to give agency reports and updates and to discuss pertinent information that you think is appropriate for today's discussion. Does that make sense to everyone who's around the table? Okay. Very good. I am going to start to my right with Councilwoman Tahar. I should also note, again, for the audience benefit as well as those of us who are around the table this morning, please use the microphone. Unfortunately, we only have 3 of them, so we're going to be passing them along for much of the discussion this morning. I would also note that unless you see a green light at the base here, the microphone is not on. So make sure you see a green light. If you do not see a green light, you can push the button that says push at the bottom of the microphone. So again, I'm going to begin with Councilwoman Tahar to my right.
Good morning. I'm Linda Terhar. I'm a member of City Council, beginning my 6th year on council.
I'm Carla Scruggs. I'm the Parks and Recreation Director for the City of Saline, and I am starting my 25th year here at the city.
Good morning, I'm Jane Nickert. I am the Director of Nursing at Washtenaw County Public Health.
Good morning, I'm Denise Rabideau, the CEO and President of Evangelical Homes of Michigan and soon owner of the Center for Innovation and Not-for-Profit Excellence, formerly the hospital. So excited. Sitting next to Dave, which is also exciting. We've been negotiating by paper and never have met each other, so it was nice that you put us next to each other, Brian.
And she's still smiling, so that's good. I'm Dave Brooks. I'm the new guy at the table. I'm the new administrator at St. Joe, Ann Arbor, and Livingston Hospitals and Health System. Good to meet everybody, and pardon my back.
Good morning, I'm Michael Miller. I'm the Regional Chief Mission Officer for St. Joseph Mercy Health System.
Good morning, I'm Michelle Strypka. I am the Marketing and Communications Officer for St. Joseph Mercy Health System and a member of the community.
I'm Jameel Aikens, Executive Director of Saline Area Social Service, and we're the beneficiary of St. Joe's generosity with our new home on Michigan Avenue, 224 West Michigan.
Good morning, I'm Janet Dillon, Saline City Council member.
Good morning. Is this on? Is it on? Oh. I'm Cheryl Dirksen with Great Lakes Caring Home Care, Palliative Care, and Hospice, and we've been providing these services for residents in their homes for the last 20 years.
Good morning. I'm Stephanie Hemker. I'm the Clinic Director of Probability here in Saline.
Good morning. Todd Campbell, the City Manager for the City of Saline.
Good morning, Roger Simpson, Vice President, Huron Valley Ambulance. Larry Winnick, the Police Chief.
Craig Heft, Fire Chief, Saline Area Fire Department.
CEO, City Council member here in Saline. I also have a background in law enforcement of some 40 years, and my wife, my spouse, has been a longtime nurse with the St. Joe Mercy Health Center.
Good morning. My name is John Stanowski. I'm York Township Supervisor. I'm here to support my friend and neighbor, the mayor in the city of Saline. I believe this issue is not a local issue, but becoming a regional issue, and that's why I'm here. Thank you.
Hello, Rena Shemin, the Director of the Saline Area Senior Center.
Very good. Thank you all. At this time, we're going to work our way around the table again, but as opposed to starting at my right, I'm going to start at my left. I've already pre-warned Rena that she's going to be on the spot first. But at this time, and let me preface by saying this, my friends. The intent this morning is that this is a very open and casual conversation, but very much focused on our future and how we can meet this community's health care needs. So at this time, again, we're going to start with Rena from the Senior Center, work our way down this side of the table, and then back. And Rena, I would invite you and everyone else to spend a few minutes, maybe no more than about 5, giving an update on behalf of your agency, what you identify as trends and deficiencies, things we need to be aware of, and things we need to plan for the future. So I know that's a lot, but I know you can handle it. So I will turn the floor over to Rena Shedman from the Saline Area Senior Center.
We at the Senior Center are proud of the fact that we work with people from, excuse me, from retirement to assisted living or to assistance when they need assistance to keep them healthy. I guess our job is to keep people active, keep them physically active, mentally active, and then assist them when they get to a point where they need assistance, and mostly referral services to many of the different organizations here around the table. We provide a huge list of activities, both sedentary and active, for the whole gamut of bodies and interests that people might have in keeping themselves busy. I don't know that I'm going to go the whole 5 minutes here, but if anybody has any questions of me, I'd be glad to answer that. But again, we go from retirement to referral services to when people need beyond retirement or assistance.
Thank you, Rena. A few other things, and I should have prefaced by saying this. If you do have questions after an individual's reports or comments, please raise your hand. We'll entertain those. Again, this is supposed to be a very open, very inclusive dialogue. If, as we're working our way around the table, if you choose not to make comments, that's fine. At any point, just pass the microphone to your neighbor. The other thing that I should note, and I know I've discussed this with many of you around the table, but I will articulate this at this time for the audience's benefit. I am under no illusions, my friends, that we are going to solve any critical or long-standing issues or deficiencies this morning. The purpose is to begin a dialogue and discussion, and I know that there will be future opportunities for collaboration and future opportunities for us to work together to resolve some of the issues that exist in the Saline community. But again, the purpose this morning, the genesis, was to have an open discussion, to hear everyone's thoughts and ideas, and to identify strategic steps that we can take moving forward. Apologize for stealing your thunder, Supervisor, but we appreciate you being here. The floor is yours.
Not a problem. Once again, John Spinozzi, York Township Supervisor. We're not as large as the city. We don't have as many employees, but I do believe that this is an issue that we need to be aware of. My purpose here in attending today is to gather as much information as I can and share it with my Board of Trustees. I will attest that I know Rena, and I've had an opportunity to use her services. We have twice gone up to Mackinac Island with a group of 4 people, and what a wonderful trip it is, and I hope we can follow that up within the next year or so. Thank you.
Again, Jack Seo with Saline City Council. There's several things that come to mind, one of which my wife certainly told me that I ought to bring up here, and that is the state of mental health care in Washtenaw County. When I first became a policeman, there were a number of places to take people for mental health care. There's Mercywood Hospital out on Jackson Road. There's Ypsilanti State Hospital down here on Willis Road. Willis Road, I believe it is. We had nearby facilities. There was York Woods for youth down at the Ypsi State property. Eloise was over there in Wayne County, right on Michigan Avenue. There was a robust, I think, I'm not sure how effective, but there was a lot of mental health care facilities around the state, run by, I believe, the state. As a police officer, I saw a lot of those former mental health care consumers who've been pushed out in the street who are now being warehoused in jails because their public conduct was not such that was tolerated. Many of them were violating the law, left unsupervised to medicate themselves. So I think that's one problem that we face now that perhaps we have not in the past. The other one, of course, is the fact that I think many in the city of Saline now regret the loss of our healthcare facilities within the city limits. I guess from a business perspective, I certainly understand why it happened, and there are other nearby places, but I think that tends to be kind of a sore spot in the city of Saline. So,
Well, you guys are all good. I'm not sure where I'm going to go here with this. But our firefighters, we certainly respond to everything from A to Z. So we're on the other end of the health and wellness. We see the difficulties it causes. What the biggest thing in our mind right now is the substance abuse and the drug task force. That's big in our game plan because it's sad to see, young people dying from this. So that's probably number one with us. And certainly we work with the senior citizens here in the community. We work with social services at Christmas time. So we feel like we take a big part of what's going on here in Saline. So all this is very important, and I'm glad you're all here. Larry Rennick, the police chief, once again. These two stole my thunder here. I had both those things written down, but mental health certainly is a problem. Mr. CEO, having been in law enforcement, it's a problem that continues. It will continue. I'm not sure exactly how it's going to be fixed, but certainly we need to fix that part of it. And as the fire chief said, sitting on the task force, the tragedies that we have with the overdoses and the opiate problem, that's a big problem before us. So we're going to need a lot of help with that.
Roger Simpson with Huron Valley Ambulance. Our mission or our role is pretty obvious. We provide all the ambulance transportation in Washtenaw County. We're in all in part of 8 counties in southeast Michigan. I'm the vice president of the Washtenaw County operation, so all the ambulance operations in Washtenaw County are my responsibility. We provide emergent transport and non-emergency transportation, wheelchair services, bus services in some of our areas. So we're not just an ambulance service. We've grown over the years. When I started with the company 35 years ago, we had 45 employees and 5 ambulances in Washtenaw County. We have 650 employees and over 100 ambulances out on the roads today. One of our specialty units that we have here in Saline that serves the Saline area is housed at the Saline Fire Station, is our paramedic first response unit. We call them an ECHO unit, and the purpose of that unit is to respond to emergent calls in the area. They usually will arrive with the fire department first before the ambulance gets there. The paramedic on the unit can start any procedures that need to be done with the assistance of the firefighters. And then the ALS unit gets there and transports the patient to the hospital. We have one here in the Saline area. We also have one up in the Dexter area. They've proven to be very popular units, very helpful in getting the appropriate help to the patients as quickly as possible. One of the newest adventures we're embarking in is what we call our community paramedic program. We started that August 1st of last year, and what that is we have a community paramedic, and these are paramedics that have been specially trained with advanced training in assessment and treatment of patients. We have one unit on right now. This is a state-approved study that we're embarking in. It's a 3-year study. The paramedics have audio-visual connection with the docs over at St. Joe's and University to provide them with medical direction. They can see the patient by video. The patient can talk to the doctor can talk to the patient, as well as the medic there. The purpose of the program is to try to reduce unnecessary emergency visits to the ER. We roughly figure that a trip to the emergency department for somebody that has a urinary tract infection, for instance, is about $3,500 when you add in the ambulance bill to take them to the hospital and all the charges at the hospital. The community paramedics have been successful so far in going out. We actually carry antibiotics now on the unit. In consultation with the physician, we can administer the first dose of antibiotics to the patient, arrange to get a prescription for them, and in some cases we've actually gone to the pharmacy, picked the prescription up and brought it back to the patient. In a few instances, we've elected to drive the patient to an urgent care for treatment of some minor problem. So that's been going very well. Again, it's a study. The state has approved us to also start a unit in Jackson, which will be starting the 1st of March. That'll be on a 12-hour per day basis to begin with. Same rules apply with the state, and it's the same, pretty much the same program over there. And that's going to be run through Allegiance Hospital. They're going to be our medical control over there. So we have a lot of programs. As with all healthcare, the folks from the healthcare industry here can tell you reimbursements is a big issue. That's one of our challenges with this new community paramedic program is getting somebody to pay for it. Our board, Emergent Health Partners is our mothership, if you will, has elected, our board is elected to fund it for the first 2 years while we try to negotiate with government, Medicare, Blue Cross, all the providers to assist us in paying for this to cover the costs of it. So we've got our work cut out for us, but so far the response from the patients, we're going to be doing a 100% patient survey, satisfaction survey with 100% of our patients to monitor the program. So it's exciting. It's one of the things we're doing, and as we say, we're not just an ambulance company anymore. We're branching out. The one thing that does come up too is I don't know if there's any home health care services here, but that was a question that came up when we first conceived this whole program was, well, you're going to take work away from the home health care agencies. And that's actually not true because we are more in the episodic part of it. And the 2 o'clock in the morning call where, I've got a urinary tract infection or whatever. The community medic can go out. Home health care won't send somebody out until the next morning. They don't have the facilities to do that. So this kind of fills that gap, and so far we've had good success with it. So, thank you.
Please, we've got a question here for you. Oh, yes, sir.
Thank you. I was very excited to hear about the study that you're conducting right now. Could you help us understand the expected timeline for that project and when we might expect to understand some data and results of it?
The data is, the state's requiring data. There's, I think, 20 elements that they require right now that are being sent in. Bob Domeyer is our medical director. He's with EPMG. He's one of the ER physicians over at St. Joe's. He's our medical director, and he's coordinating with the state as far as the data elements. We're actually looking at adding some more for our own use. And again, the patient satisfaction survey was one of those areas that we're very much interested in to get the feedback from the patients that we're dealing with. So far, the response has been phenomenal. We get patients that are calling us and 2 o'clock in the morning going, can you send that community paramedic over to my house? It's like, okay, but so we're watching that as well because we don't want to get into that business either. We want to take care of immediate needs, but not the emergent stuff that we would handle it with an ambulance. So we are capturing data elements, and we're going to be adding more as we go along. So we can get them for you.
One of the important features of this is what's happening in the past. That call would come in.
Yeah, you guys. Yeah.
They would know. So a lot of people were going to the same house, and maybe it was just the temperature or whatever. So having this, that's
one of the other things that we've also started with this, and Denise is probably going to talk about that. We're working with Saline Evangelical and Glacier Hills right now. We're actually going in. Our community medics, we carry an iStat. It's a blood analyzer. We do a Chem 8, so we can get blood results, test results that normally would have to be, the patient have to be sent out to the lab, or the blood would have to be sent to the lab and wait to get it back. We can do that bedside, and we can come in and do 12 lead EKGs and stuff. So we're actually coming in now doing blood draws for the nursing home, or for Saline Evangelical and Glacier Hills, doing labs, doing 12 leads. Dr. Huckins is one of the doctors that's kind of oversees that, and she's her and Montoya, is it?
Dr.
Montoya.
Yeah.
They're like always available on the phone, 2 o'clock in the morning,
So it's an impressive statistic, so I'll give you the statistic. Since we started with the community paramedic program, obviously we serve 500 or more older adults on a daily basis. In Saline alone, Readmission to hospital, 3%. National average, 11% to 14%. So this is an amazing process. Our home health agency is starting to use it as well. So these are these older adults whose clinical conditions change so quickly, even in evangelical homes. The idea of putting them in the middle of winter onto a gurney, transferring them to the ER and letting them sit in the ER, because obviously healthcare reform doesn't allow the hospital, in defense of them, to admit this client. So they sometimes spend 12, 14 hours on a gurney. They're 75 years old. So whether it's in their home or it's in evangelical home or the Ready Center, this program has really had a significant impact already in healthcare reform. 3% readmission statistic is amazing.
Yeah. And that's just with the one unit so far. So obviously, if the numbers increase and we can find some sort of funding, we will certainly increase the program and add more units on the road as that all becomes available. One of the things, and I'll shut up here, one of the things that a lot of the patients say when we come into their house with a community paramedic is, I don't want to go to the hospital. I don't want to have to go to the hospital. And so we're trying to keep their requests and not send them to the hospital. And I will say that if there's any question at all, they go to the hospital. We're not going to take a chance with leaving somebody at home. But all that's done in consultation with a physician at the hospital anyway. So they can actually, again, they talk to the patient, they can see the patient can see them, and everybody's in agreement before we leave that they can stay home safely.
I'll take a second and pile on. In my short stay so far, I was in the ER when they were on the phone, when the ER doc was on the phone with one of your community paramedics, and I was watching and listening to the interaction.
Yeah.
And it was clear the patient, a community member, who did not need to come to the hospital from a clinical viewpoint. I mean, the paramedic and the physician were very aligned on that, and the fact that they could have an interchange and the community member could feel safe, that they were getting the right type of information to feel safe and secure, it was great to see.
Right.
That patient did not need to come into the hospital. That's not what the ER is designed for. It's obviously designed for life and limb-threatening issues.
Right. Yeah.
So that's a win-win from everybody's viewpoint. And it's a wonderful program. It's nationally innovative, just so people are aware. I've read about it in national healthcare journals, this pilot program. And I think, I don't know if, Roger, if you're coming in, but some of your leaders are coming in a couple weeks to the hospital, and you're going to be presenting to our board, and we're prepared to figure out how can we fund a portion of it ourselves,
Yep.
Which I know is antithetical potentially to some people. Well, why would you spend money to keep people out of your service? But the key is, how do we design a healthcare system and a provider system, social, community, governmental, private, nonprofit, et cetera, that is organized to put care in the right place and not be so disorganized, as the history of healthcare has been, that people end up in the wrong settings for care, clinically or economically. So it's an exciting opportunity for us, and we're thrilled with the leadership that HVA has taken with this.
Thank you. Yeah, the global issue is ERs have turned into being, just a doctor's office type thing. People go to the ERs, and we take them by ambulance to the ERs, going, really? We don't, and it doesn't affect the ER at all, because it eliminates people that are taking the time of the staff that really need to focus on more serious critical patients and not have to deal with a UTI or something like that can be handled outside the facility.
Sir, real quick, and for your benefit and for the audience, because I'm not sure you were here when I mentioned this, and if I wasn't as clear, I apologize, but we did have, well, we still have one. We had 2 public comment periods. I'll allow a question at this time, but there will be opportunity at the end of the meeting for networking with most of the people around the table.
You mentioned wheelchair transport, so I'm a resident at the former hospital CEO and currently a college professor teaching administration. So that's about me, but my question is about my son. He's quadriplegic and he's in a wheelchair, so he goes to Ann Arbor doctors. I'm sure a lot of you that go to Ann Arbor see physicians. So we have some issues with transportation that I wish you would just talk about sometime during the meeting. I know I've talked to some of your staff, you and I haven't had a chance to talk, but I know there's a People's Express program here, but, you know, that's pretty pricey if you're gonna leave. If you just come to Saline, it's like $2, that's great. But if you need to go to a physician, that can be another $18, $20. We rented a house before we moved into the community, and we were part of the Ann Arbor Transit, and that was very economical. I know Saline's not part of Ann Arbor Transit, so I think if some of you haven't realized that, you know, that's a great need. Your access to care is what healthcare reform's all about, right? So you guys can just put that on the agenda sometime, and I don't think People's Express is that, but you know, it's a very small population. If you don't want to go shopping, it's fine, but it's not cost benefit. It's take People's Express within the Arbor for healthcare, so particularly for handicap. So I know you got a program that's probably fee for service type thing.
Yes.
Just to throw it on the agenda.
No, we appreciate that. Very good. We're going to continue working our way around the table. Did you have a question for the gentleman? Yeah, that would be fine. We'll jump from HVA to Dr. Nagpal. And Smita, do you want to introduce yourself because you were not here when we did introductions?
Absolutely. Can everybody hear me? Okay. I'm Smita Nagpal. I am the co-owner of Stillwater's Counseling, which is a Saline-based practice. I co-own that with my husband, Dr. Pearson. And we are very fortunate to have had a place in this community, I think, that sort of feels like, because I agree with Mr. Jack, I forget your last name, yes, that a lot of mental health services have been cut over the years, and we have dealt with the effects of that as well in working with our clients, because we feel like sometimes we are the first responders and we are the only responders even in very severe situations. It really should not be the case. But that being said, I think we do have a good service in the community with several licensed professionals, and myself and my husband being fully licensed psychologists. And I don't know if people know this, but I'm also the chair of a committee called Saline Alive, which is a community group for reducing stigma surrounding mental illness, and particularly severe mental illness. And the group does a lot of good work in the Saline community to help bring awareness to issues of stigma, and just bringing in speakers, et cetera, to educate the community about mental illness. So I feel like from my vantage point, and I think I'm also known in my role as the co-chair of the Substance Abuse Coalition. So that's sort of all my different hats. And from that vantage point, it feels like we do have some significant resources in this community to bring to bear to mental health. We do not have access, very good access to facilities where there might be a severe need, a serious situation. That access is very limited. But I also want to say that I think the city of Saline has done a really good job in terms of addressing some mental health needs, and of course the substance abuse piece as well. Because I see mental health as more of a bigger thing than just going to see a therapist or going to the hospital, ER, or whatever, but more like having services that enhance our mental health, such as the rec center, place. I was excited to see the yoga in the park piece, because that kind of highlights mental health and well-being. And I think so. I guess I want to say that I feel like we're fortunate to live in a community where some of these pieces are being addressed and looked at. But I'm very curious to hear as to what people perceive as the unmet needs, the gaps in our community. And I guess since I do have to run, I'm going to have to take my answer off the air.
Let's jump back to our city manager. I do want to make one announcement for the group's benefit as well as the audience, and I seem to articulate this a lot at council meetings. On occasion, my friends, your cell phones interfere with the microphone. So when you are speaking and the microphone is near you, if you want to put your cell phone on the floor, in a purse, in a pocket, that would be helpful. Okay? Sorry about that, city manager.
Not all. Thank you, Mayor. I'm excited because from a city manager's perspective, when a community of our size, of our quality of life, has to me a significant event where the hospital relocates, that to me for the future well-being and health of the community is certainly in the forefront of my mind. However, there's certain things in life that are inevitable, and that's change. And we've already heard some exciting changes on how health care is provided, and we'll continue to make those improvements. So I mean, that to me that's exciting, but certainly it is critical that that we have improved from. Not sure. Sorry. HAs? Is it coming through okay in there? Okay. All right. So, so having said that, I think it's critical that we continue to move forward at to me, a fairly significant pace to try and make these improvements for our residents, our businesses, because I think it's critical for the future stability and growth of our community that we have the necessary quality health care. Yet certainly we have two world-class healthcare facilities 20 minutes away, but again, the key there, 20 minutes away. So hopefully we can, again, HVA provides a phenomenal service. Unfortunately, I had to utilize their services for my daughter this summer twice, but they were phenomenal, as is, of course, our world-class fire department. But again, there's certainly a lot of gaps that need to be filled now that we no longer have a community hospital.
I would just like to thank everybody for allowing me to be here. I'm pretty excited. Being a physical therapist, I work with a very diverse patient population, from the youth to the elderly. We recognize the importance of wellness throughout the lifespan, but one area of need that we've identified is, especially for the elderly, the specific group of people that come to a point where they no longer qualify for therapy services through their insurance, but they still need some form of wellness or exercise, and whether it be financial limitations or access limitations such as transportation, kind of getting in contact with people here and through the community, that we can put our patients in contact with them so that those needs can be met. Also identifying gaps in the community where our skills can be utilized to better serve the community. So.
Thank you for putting this together, because I think, just getting together and talking like this, we can make some connections to better serve this particular community. At Great Lakes Caring, we provide services, skilled services in the home for patients that are homebound. And homebound means it's a taxing effort for the patient to get out of the house. It doesn't mean they're bedbound. It means that, unless somebody drives them to physical therapy, they're not going to get to therapy. Unless somebody drives them to the doctor's office to get their med boxes filled, that's not going to happen. And so we provide that service to patients that meet homebound criteria in their home. And everybody thinks of home care, after you get home from the hospital. We actually can help prevent hospitalizations. I was very excited to hear what you're doing with your community paramedics. When you identify people that, they're at risk of falling. We're worried about them falling in the home, but I can't get mom and dad to physical therapy 2 or 3 times a week. Those are the people that we can come to the home and provide nursing services, provide physical therapy, provide occupational therapy, a speech therapy for all of the cognitive issues that patients have. And we also have social workers to help connect patients with these community services that are out there. I was very excited. We should probably talk more with HVA because we can help identify those patients that need more of these services. One of the things that we do uniquely at Great Lakes Caring is we answer our phones by a live person 24 hours a day, 365 days a year. So if at 2 o'clock in the morning somebody is having a UTI, if they're on service with us at Great Lakes Caring, we have a nurse right there, talks to them on the phone. If they need a nurse to come out and see them at 2 o'clock in the morning, we have nurses on duty that will come and do that at all hours of the day and all hours of the night. And that's just our home care side of things. We help patients age in place in their home, wherever they call that, throughout the entire continuum through their end of life with the palliative care services and then our hospice services that we can provide in the home as well. Another area that we can really work together with hospitals, with everyone, is to prevent rehospitalizations. That is one of our #1 charges in home health care, to help keep people safe and independent in their home and help prevent them from going back into the hospital. And at Great Lakes Caring, for the last 1.5 years now, we've had a department dedicated to preventing rehospitalizations. It's led by a certified life coach, so somebody that's been through all of the training. We have a whole computer model that identifies the patients that are at a higher risk of returning to the hospitals, and then have various, we call them every day to see how they are. There's all kinds of education. So we do many unique things at Great Lakes Caring to keep people out of the hospital and help prevent those rehospitalizations. So much of this is identifying these patients when they qualify and early enough to help them stay safe and age in place. So it's great to have everybody together to help do that and reach these people and get the services to them.
I just want to thank the mayor for facilitating this forum so that we could start the discussions to move forward. We've been a bit stagnant after the hospital closed, and we need to just plan forward and look at not just our health needs, but the wellness side of it. And I'm very encouraged hearing the discussions here about what is about being proactive and it not just being an issue of we're going to ship people to a hospital. This community has a lot of issues, whether they're mental health, whether they're minor health issues or they're major health issues, and it shouldn't be one-stop shopping. And I really appreciate that we're having this discussion to move things forward and explore other options.
At Saline, excuse me. At Saline Area Social Services, our primary service that we provide is as an emergency food pantry, and we feed up 300 to 400 families a week during the holidays. One of the things that we see is a growing need within the senior population. We service currently probably about 10 to 15% of the households that come in are from senior citizens. And one of the things that we do see is the growing trend in the Saline community of seniors as people continue to age in place. I think I was reading on some of the SEMCOG documentation or demographic forecast that the Saline senior population will increase 2.5 times by the year 2040 as people continue to age in place. What we're doing now is starting to take a look at what are some of the different ways that we can better serve seniors. One thing that we're looking at is how can we continue to utilize our volunteers. This last year we had over 1,000 volunteer hours, and with our new location, additional space, we're anticipating having up to 3,000 volunteer hours. So we're trying to see how can we utilize those volunteers not just on site, but with other areas within the Saline community to serve our seniors. Second thing is taking a look at different programs that are here and how can we connect seniors that come to Saline Social Service with other existing wellness programs in the community. Look at resources like the Saline Rec Center, the Saline Senior Center. How can we get that information out? And then if families can't afford it, what are things that we can do to help find the dollars so that families can participate? And then kind of the third thing is how can we help support transportation for families in need so that they can get to medical care or to wellness programs.
Thank you, Jameel. Real quick, if I may, Mr. President.
Yes.
St. Joe Mercy Health System has 3 people represented today. As was stated during our opening remarks, President Brooks, we want to welcome you to the Saline community and to the Ann Arbor area. How long have you been with the organization now?
About 5 months.
5 months. So, and you come to us, if I believe, from one of the points. Is that correct?
Yeah, I was previously at St. John Hospital on the east side of Detroit.
Very good. Well, we appreciate your attendance today. We understand that you and your colleagues have a presentation for us. Those of you who are in the audience will see it is projected up on the screen. And for those of you who are at the table this morning, I believe there are several copies floating around. And we can certainly get you a copy at the conclusion of today's meeting if that's your wish. So I didn't mean to steal your thunder, but the floor is yours.
You took care of it, the introduction part. And we don't want to overplay this. I think the conversation is more important. And again, we as a team are here and appreciative of the discussion starting. And I think it's a conversation that will hopefully go on more than just this meeting. I don't know if it's going to go on until 9 p.m., as you described earlier. Hopefully not. Because I'll have to make, like the other people had to leave early, I'll have to make other arrangements if that's the case. But representing the hospital, or at least part of the organized health system, we know there's been a lot of changes. We know we created some of that change. And I think what we wanted to do was just spend a couple minutes and talk about what we have done to organize and understand what's happening in the community. We heard it today already. What some of the needs are, and I think we've got some research and some data that we want to share. I think it's only going to just put an exclamation point on what we heard as the individual situations, because that's what our findings will show. But we've done this research, so we want to make sure we take a couple minutes and share it, and Michael and Michelle will do that in a second. Again, as a newcomer, I just appreciate the chance to be here. I mean, I'm looking forward to listening and learning and making sure that our health system organizes and designs what is needed to help serve this community. It's an important part of our service area. Again, I don't know who's flipping. I will. Oh, sorry, Michelle.
And yeah. Michelle, there's a cordless handheld mic up front. And just make sure at the bottom, you can use that one. Is
this one working?
You can use that one, whichever you prefer.
And the only thing I wanted to show, Michelle, if you could, just clip a few ahead to our mission statement. That's our propaganda. Oh, go back one. Right. Before that, with our map, was our propaganda. We don't need to see that today. But our mission statement, and why I wanted to point this out, for us, obviously, it's a grounding. I'm not going to read it, but I just want to point out the very last couple words, our communities. So this is a very important part of our overall communities and how we service it. I recognize we've changed the way we've at least physically served part of this community with the hospital change and closure. But it doesn't mean, nonetheless, it's not an important part of our service and our service area, and it's not our community as well. So again, we've adjusted somewhat to that with our urgent care center that's opened up over on Michigan and other things, with the changeover that we're going to have with Denise and her organization to make sure that the physical asset, the building, is productive and used by the community as well. But we want to hear what else we can do additionally to that to make sure that we're constantly evolving and serving all the needs of the community. So, and I think Michelle was actually going to talk next a little bit about
Right.
some of our research.
Yes, thank you for the opportunity to talk about this morning. I do want to say, a couple people have mentioned health reform, and as you know, we are in the midst of health reform, and we are St. Joe's Mercy Health System, and I know we've been referenced as the hospital. And it's a change, it's a shift for us, an evolution as we're talking about of how we serve the community. We are not intending to fill our beds now. We want to really keep people at the right level of service at the right place at the right time, keeping people out of the hospital, keeping people out of the emergency rooms. We aren't reimbursed to keep people there any longer. I mean, things are just really shifting, and it's really important. It's an important change. And we want to talk a little bit about that. So this conversation has been going on for us for a while. We've been looking at the future and forecasting how we need to serve the communities differently. So the hospital changed. There's been an evolution there. We've all talked about it. We've grieved it. As a community member, I've grieved it as well. We've had to access care in a different way. But as a health system, we've done some research starting in 2011 and moving through this year, which we'll talk about currently, to help understand the needs of the community and the perception of the community. We talked with community members. We did some community research looking at 400 members of the Saline area, 200 in Saline itself, and then 200 in the surrounding communities. We worked with an independent firm to understand what some of the community members think. We wanted to assess their own perceptions and look at what kinds of usage we have in this community for services, where people go for care, all those types of things. So I just wanted to point out a couple of things. We also wanted to understand what people do for urgent care and emergency rooms. That was part of that research that we conducted. And I'm not going into all the details because it was a pretty big study, but it was really trying to look at trends for our own hospital, for the urgent care, for the emergency room, and see where things went. Our research finding is that top-of-mind awareness of healthcare services available in Saline were very high. And again, not a lot of detail that I'm sharing with you here, but we asked them, are you aware of what's available in the emergency room, what's available from lab services, and so on and so forth. We went through all those types of healthcare services and needs that people have, and they were very aware of the services that were provided in the community. Only 22% of primary care physician usage was located in Saline. So people who are receiving care from a primary care provider were going outside of Saline proper, although we also know there are not a lot of primary care physicians that sit in this community physically. The majority of consumers work, shop, and have primary care physicians in Ann Arbor, with a large percentage retired. So those people that are retired are still leaving the community. Nearly 50% have lived in Saline 20 years or more. That's a significant statistic because it tells us that people aren't going to necessarily change their patterns. They're certainly, they will, but they are used to doing things the way they have for a very long time. Consumers are willing to drive to Ann Arbor for routine medical care or emergency services. There was a big part of the study that we asked people, how far are you willing to go to travel for emergency services in particular, and people were willing to travel for up to, I think it was 15 minutes for an emergency service. Consumers are willing to, moving on to the next one. This was an important point in the study. We asked them, is there a need for any additional services that you don't have currently in Saline? 80% see no need for additional health services in their community. They felt like their needs were provided. Again, it's a question that we asked. There were a few mentions. Surgical services, 6 people said we need surgery in our community, 5 urgent care, and 9 specialty care services. Again, you're asking 200 respondents, and these people are saying, no, I've got what I need in the community. We also spent some time with the physicians who sit in this community and serve the community. We asked them about what their perceptions were for the needs of the community. We didn't want to limit ourselves to our own perceptions. The physicians felt very strongly that we needed to keep a Saline urgent care in the community. They said something that was really connected to the health system. They wanted to develop a care management and care coordination models for Saline residents. There's some reference to that, what we were talking about with HVPA. We're also, they talked about developing mechanisms to help seniors with transportation for services they need in Ann Arbor. This is a theme that you guys have talked about here today. Diabetes management, education, nutrition, medication support, and preventative strategies were a consistent theme among the physicians and their concerns. Broad educational opportunities to help focus on health, wellness, prevention, and how to best utilize and interact with healthcare services in the community. Again, it goes to these transportation needs, people that are homebound perhaps, people that don't leave the community as often as they are able to or would like to. Develop partnerships with the schools that focus on health and wellness. So those were the main themes that came out of those. I'm going to turn it over to Michael Miller, and I don't know, Michael, if you want to come up here, if you want to stay there, I can advance the slides for you. But we did some community health needs assessments, and Michael can just describe those for you.
Great. If I could stay here, that'd be great. Thanks, Michelle. So as a nonprofit hospital, we are required by IRS regulations to, every 3 years, do a community health needs assessment. As part of that report, we have both demographic information, we have some health data metrics to share. So not only does that help us live up to our identity as a nonprofit healthcare organization, but it also helps us to live up to our identity as a faith-based organization seeking out those most in need in our communities. If we could move forward here, just quick look at the demographics. I'm not even going to get into this detail other than to say what we're seeing affirms comments from Mr. Aikens from Saline Social Services this morning, indicating the future growth of the 65 and up demographic. Okay, so that will be significant to us in the future here. And I would even go one more. Thank you. So when we look at the health needs across our community, I will note that one of our major sources of data for this needs assessment comes from our partnership with the County Public Health Department. So our HIP survey data, which we're just seeing solidified from the survey that was out in 2015. So last summer, this was out in the field. We're starting to get some analysis back from that now. Some high-level data here. In terms of the health status, self-reported health status of our community, the experience here in Saline is roughly equivalent to that across Washtenaw County. What's interesting to us is that there seems to be a few more residents in Saline that don't have access to health insurance. So that's an issue for us to address and be aware of. Slightly higher, well, almost, I'm not good at math, more than the rest of the county, right? 13% versus 8% in the county. And thank you, Dave. It is bigger, yes. And then when we're looking at residents not having access to a healthcare provider, a primary care physician, Saline is faring a little bit better than the rest of the county. So only 10% are reporting not having access to a healthcare provider, whereas across the county, 16%. Okay. Looking at the total of the health metrics that we do look at, as an organization, we've prioritized the health needs around obesity, so seeking healthy weights in our community, preventing obesity and helping address it. And then we'll also look in a few minutes at our other prioritized area, which is behavioral health. So here in obesity, looking at our status related to citizens being overweight and obese, you can see these numbers here. The overweight individuals in Saline tracks roughly to the county. And then there's more obese individuals in Saline than there are in Washtenaw overall. We can say that as a state, more than 60% of Michiganders are either overweight or obese, generally speaking. So in terms of state average, that's pretty much where we're at. Looking at behaviors related to this in terms of fruit and vegetable consumption, 22% of Saline residents have less than one fruit or vegetable serving a day. Okay, so that's an issue for us to look at. And that compares to the county at 19%. In terms of, we've already talked about health insurance and healthcare providers.
So, Michael, can you clarify, this is self-reported?
Oh, yes, thank you. So in terms of this data, the method that we use is self-reported information from citizens.
And I also want to make a comment that this is pretty obvious, but just for everyone in the audience that aren't really super familiar with healthcare, we look at obesity because obesity is one of the #1 factors of other indicators of health. So the higher the obesity rates, the more concerns we have for other medical issues.
That's right. Thank you. So let's move on to the next area of behavioral health, which we define as both mental illness and substance use disorder. We believe that those issues are so connected that you can't separate them from each other. We've heard that mentioned in many ways around this table this morning, and this is self-reported days in the last 30 in which your mental health was not good. So 1 to 9 days, 17%, and 10 or more days in the last 30 days. 15% people say more than 10 days they have not good mental health. And you can see how that compares to Washtenaw County. Kind of similar. Now, the thing that popped out to us in this data center on behavioral health that was the most interesting was this metric around binge drinking. So across Washtenaw County in our communities, all the areas are less than 20% who've reported binge drinking, and Saline pops up. They're at 25% for this issue. So that just makes us wonder what we can do around that. And when we also think about this in context of the opioid overdoses that we're seeing across the county, this is particularly concerning, right? One of the other hats that I have the honor of wearing, I serve our county as a member of the Board of Health. So I also have some access and awareness of, county-wide data related to opioid overdoses. And what's interesting is while that is an issue, to be sure, when we compare 2014 to 2015, there has been a reduction in opioid overdose-related deaths, and there has been a reduction in opioid overdose-related ED visits. So while 2 years we can't say that that's a trend, I think that and I want to acknowledge this community's awareness of issues around that and its work around establishing a task force to address it. And we look forward to understanding how we can work together and collaborate to address these issues and more.
Thank you. Denise? And Denise, I should acknowledge you have a couple of your colleagues who are one to the right, one to the left, I believe.
So we have Heather Feldkamp is here, and Linda Olinsky, our Chief Financial Officer, is here as well. So I'm going to talk just, I guess I'm blessed to be almost the last couple, right? So I can kind of put some things together. I think the first thing to say is that I think, change is evident around us, and transition is something I think all of us in healthcare have to accept. And so I want to say out loud that this is truly, we view this as a blessing that we were able to come to some agreement with St. Joe Saline, and specifically the health system around the acquisition of the hospital. So it's been a wonderful partnership. As we started to assess this and decide if we were going to take on another 100,000 square feet, because Evangelical Home Saline is 150. So now we have 250,000 square feet to provide health care. But one of the things that was so fun is I had to go up on the roof. If you're going to purchase something, the roof should be in good shape. And believe it or not, our forefathers combined the roofs. It's one roof. It is actually one roof, and the structure is one building, essentially, with just that wall that was put there at some point. So, that's going to come down. But we've had a wonderful relationship with St. Joe Saline, and it's going to continue. Evangelical Home's been named as a preferred provider in their physician accountable care organization and in their health system network. Wonderful providers like Huron Valley Ambulance that has helped us with some of the readmission, and then this whole attention to community health and well-being. So I wanted, before, he just left, the gentleman, I wanted to talk about a couple things. We provide $2.3 million in charitable care a year, and a significant amount of that is in the city of Saline and Washtenaw County. So we have a program called Safe at Home, by the way. And if you know of anybody that's having transportation issues, you can just call Evangelical Homes and we will provide charitable transportation for you, either support that or whatever. And I know Todd left too, but a couple years ago, there you are, okay. So a couple years ago, Evangelical Homes supported the People's Express, and I want you to know we would do that again. We would make a stipend, we've done that before, to the city to provide charitable transportation to those that couldn't, especially as we look at those statistics around older adults. So we would make that payment to the city so that the People's Express allows when that person who's handicapped needs to get on there, they would just have a token that would allow them to be transported to a health doctor's visit or whatever it is. So you need to know that we're here, we're embedded in the community. We serve 5,500 older adults, so we are in the older adult business. And so I can tell you that 65% of that is in the city of Saline and Washtenaw County. So health and wellness is a big deal for us. And I think that's something we could work with Carla and some of the city on, and using our resources, whether it's Probility or St. Joe's, to really attack that. Evangelical Homes employs 11 wellness coaches, personal trainers. So that gap between skilled nursing and home health care and outpatient therapy, we have personal trainers that do that. And so it's a much more cost-effective way to provide rehabilitation and health and wellness. We've had some fun with Saline Senior Center because we just expanded our home delivered meal program. We provide 10,000 meals, and it is in Washtenaw County and in Saline annually to homebound older adults. We provide a hot lunch, a cold dinner, and now we expanded it with Rena's help and Lori's help to holidays. The meals are sent out and delivered by our staff on the holidays. So if you know of some nutritional needs within the community, just like St. Joe's health system, Evangelical Homes is a 501c3, and so we have some obligation to provide services to the community, and we're welcome to do that. 3 tons of food were collected last year by our employees. It's amazing what 11 days of jeans will do to a workforce. So 11 days of jeans, 3 items a day, 3 tons of food collected by our 1,200 employees, and a lot of it went to Saline Senior Center. We stocked a lot of pantries. So if you know that, we could, fruits and vegetables are perishable, but there could be a way that we could do a drive around fruits and vegetables, and Jameel, we could help you with that as well. So we want to be focused on that. We provide services to Mill Pond, but I can say that, and that came up in the study, that I think there's some wisdom, Mayor, in looking at low income or that gap older adult or anybody in the community that falls through the crack in terms of receiving support and social services support. And so I think there is something to be said about low income and how they have access and transportation and that piece. We're blessed by wonderful education systems. We don't, we're all conscious of what's happened in Flint and in the city of Detroit. And every morning I wake up and say a prayer for Saline and the community and what we've been able to provide. But I think us in healthcare would say that one of the things the Saline schools could do better at is making sure our youth understand the tremendous amount of opportunities for careers in healthcare and how rewarding they could be. So I'd love to have time with Scott to talk about that as well. Thank you here in Valley Ambulance. This community paramedic program is amazing. And it shows, this example of Rena and Roger and St. Joe's shows that, I speak nationally a lot, and we should, even though we have some opportunities with mental health issues and drug issues and alcohol issues, I speak of the city of Saline very fondly when I'm in front of a podium because we have continued to work on it. We have some things to do, but I think we focus on healthcare. Sure, we don't have a hospital there, and even though I live in Ann Arbor, I always came to Saline Community Hospital because it was so easy and everybody knew me. But we still should be blessed with what we provide here in the city of Saline. Loneliness and isolation is a big issue for homebound individuals, whether they're disabled, mentally ill, or older adults. And so Evangelical Homes does a lot of technology, and I'd encourage us to think about that. We have 300 older adults that are connected every day with us through a web-based portal, and they wake up with us every morning and tell us how they are. And it's all done by wireless technology, and it calls our cell phones. We provide another, that's 300, we provide another 250 individuals with free Lifeline service. So Help Me, I've Fallen, and it calls our cell phones as well, so we know immediately whether an older adult has hurt themselves. And we just received a grant that I challenged St. Joe's and some of the healthcare providers around the table to provide affordable home care in a way that's pretty exciting through sensor technology, which allows us to make sure someone who's homebound is moving around their home appropriately and not at risk of fall or safety issues. And so we have a grant that we'd love to share with you, or even with your help. That happens to be a Detroit-based grant. But with your help, we'd love to try to go to a community foundation locally and see, because we have some amazing statistics on using sensors to prevent transfers to hospital, poor nutrition that leads to illness and readmission to hospital, and also just general making sure homebound individuals are okay and safe. So I think that's it. I appreciate being here. It really is a wonderful community, and I do want you to know that that's what that Safe at Home Fund is for. So when I sit around the table and I hear of someone not being able to go to Ann Arbor for a visit, you just need to call us. We'll pay for it.
Denise, if I may, real quick, I don't mean to put you on the spot, and if you don't want to talk at greater length about this, that's fine, I guess. But the acquisition of a property that is currently owned by St. Joe is really exciting. Your organization has a pretty amazing vision for what you want to transform that facility and that space into, but there's also opportunity for public feedback, and that has been included in some press releases and media articles. Do you want to talk about that?
Oh, yeah, so we've been getting a lot of, everybody said, you are crazy, Denise. Why would you actually let a community tell you what to do with 100,000 square feet? But it's been fun to do that, so some of the feedback has been about mental illness and day programming that has come out, expansion of our Everybody Loves Evangelical Home in the Ready Center saltwater pool, right? So it's very unique. We have 12 certified aquatic therapists, and so another comment that came in, if you've been in that 90-degree saltwater pool, life is pretty awesome when you get in it. It has jacuzzi jets, and you can actually swim in place. So it's a hydrotherapy pool. And so somebody said we should put another one in the surgical site at the hospital. That'd be a pretty damn big pool, wouldn't it? So I think, we're not sure about that one, but there's been lots of comments. So you can go onto our website in evangelicalhomes.org /Center of Excellence, and just give us your feedback. And we'll be publishing again a press release about what the community said about the use. But we're going to expand the Ready Center. We're going to expand some of our therapy programs for older adults who live in this community primarily. And we know that Trinity and St. Joe's has the relationship with Probility. This will be a different kind of therapy. And then some services for low-income older adults in the community as well. So we're excited. Our kitchens are 48 years old, 1974. I have to do my math. But whatever that is, the hospital kitchen and the 3 kitchens at Evangelical Homes are. Now I said something, Craig will be on my back seat all the time. But anyways, we're going to redo the main kitchen at Evangelical Home Saline, about $750,000. And in order to do that, we've been struggling with it because we would have had to shut down our kitchen and bring a trailer in to run food service, because we serve 400 plus meals 3 times a day at Evangelical Home, so about 1,200 meals a day. And now we can use the hospital, oh, there's the light. We can use the hospital's kitchen, which will cost us, they've done a great job of keeping it. The former hospital's kitchen is ready with probably a small $100,000 investment. we can run our food service while we renovate our main kitchen. And eventually we'll expand our home delivered meals down into the hospital-based kitchen. I've been here 22 years, and you know the former St. Joe Saline used to run a cafeteria that was open to the public, right? And so I've been here long enough to know that that will be something we will also do with that kitchen in the former hospital space. So we're blessed by this partnership, and I just gave Dave my phone number because we've been communicating by email, signing these big, complicated 80-page documents for life, but now he can see me in person, so.
So Washtenaw County Public Health is the prevention arm, if you will, of health care. Our goal is to provide, do data collection, surveillance, and provide clinical and home-based services that hopefully will contribute to the prevention of disease outbreaks, to decrease infant mortality and maternal mortality, to address nutritional deficits. We work with a number of partners that sit around this table because, as I mentioned and Michael had talked about, we collect a whole lot of data from a whole lot of sources. And we're very fortunate in that because we are all municipalities within Washtenaw County, we are gathering data from a number of communities and really can look at that data and identify, there seems to be some trends happening in this portion of the county. Who do we need to talk to about that? So we really are designed to be prevention, to look at what's happening with trends, to start to identify partners that can help us implement some strategies when we see something, especially around the areas where public health isn't necessarily, we don't necessarily have mandates. So all of you probably know, or most of you know, that there are some things that we have to do. We have to follow up on diseases or reports of communicable diseases. We have to inspect all our restaurants. We have to make sure that we have appropriate wastewater systems. We have to make sure that we provide immunizations for children and adults. We have to make sure that we control TB in the community. There's a number of things that the state health department mandates us to do. There's also a lot of information that we gather that is important to us in terms of community health and what we need to be looking at. So we know that we have asthma problems in Washtenaw County. We know that we have problems with cardiovascular disease. We obviously, diabetes is a growing concern in the communities. So we really count on partners to help us strategize to how we address some of those issues. And as Michael mentioned, we do a lot of surveys, and out of our HIP surveys, there have been 6 areas that have been identified by the community as the areas that we need to focus on, which include vaccine preventable diseases. So when I say vaccine preventable diseases, we're talking about flu, we're talking about whooping cough, we're talking about meningitis, okay? Perinatal health is an issue that we're addressing, okay? So we want to make sure that we have healthy babies, that babies, stay in utero the 40 weeks that they're intended to stay there, and that they're of a good birth weight when they're born. We are addressing, or the issue of mental health has come up several times, as well as substance abuse. We're also looking at obesity issues and access to care issues. So those are our 6 priority issues in terms of our community health improvement plan that Washtenaw County Public Health is currently working on. So that's all I have.
Good. Very thorough.
Do you mind if I go up front?
Absolutely not.
Understand, sorry. Stretch out a little bit here. So I'm Carla Scruggs, I'm the Parks and Recreation Director. And listening to everyone's, what they do and what they are working on, I made a lot of notes. So I'm going to skip around a little bit. Someone ringing here? Sorry. So a couple of shameless plugs. 2016 is, we're celebrating our 25 years of recreation and the rec center here in Saline. I don't know if you've been watching our website or Facebook or cable TV. Chase has been putting videos on cable TV, but we're doing a 25-week countdown. And we have guest presenters wishing the rec center a happy 25th, and we're kind of making it a fun teaser where we have guest people coming in, so they're giving a clue to who the next presenter will be. So I encourage you to take a look at our website, or take a look at cable TV, or our Facebook, Be Friends With Us, or it's also on the Saline Post. But we're doing these countdown videos to our 25th anniversary celebration, which will be June 12th. And everyone is invited, and we really want to make this a big deal. It's not only the 25th for the rec center, but it's also the 150th celebration for the city of Saline, which is a huge deal. So we really want to make, the year of 2016 full of celebrations. What we do, what the Saline Parks and Recreation, what the rec center does, I consider us a proactive service. We're the ones that, along with a lot of you, we're providing fitness opportunities, we're providing health and wellness programs, and looking around this table, I think we're pretty much partnering up, or we've worked with just about everyone here at the table, and if we haven't worked with you, we want to work with you. I think it's really important to pool our resources and to try to make the best of all of our dollars in providing things to our community. So with that, I'd like to mention, I think it was Dr. Nagpal mentioned that we had a Yoga in the Park program last year. Huge success. We were funded through the Judy Ivan Community Health Endowment Fund. I think that's how it's termed. But they sponsored that program last year. We were averaging 25, 30 people every week. We only had to cancel one Saturday because of rain, and we had a perfect summer, so it was really well received. We got a lot of great feedback that we want to have this again. And so shamelessly, I'm putting this out there. We need a sponsor for this program this year to be able to provide this. It was a really neat opportunity for people that haven't had a chance to try yoga or to be out in our parks. Actually, Henny Field is not a city park. I just want to clarify that. That's a school property, but we use it as a community gathering spot. And I think there's a lot of potential for other activities that can go on at Henny. But we also engaged Main Street, and we also engaged the farmers market to cross-promote because we wanted people to come down for the yoga in the park and then walk up and grab a coffee and go, buy things at the farmers market, know about all of the different opportunities in Saline for, and in my opinion, it's community health. Our Thursday night music series is community health. Enjoying each other's company and listening to music and eating at our downtown restaurants, that helps the soul. I think what we do is we try to provide that. The rec center is it's unusual for a small town to have a rec center. I'll tell you what, we're the envy of a lot of communities around Michigan because we have this. It's a place where our young families, kids, adults, older adults can come and have a place where they can get fit, stay fit, where they can socialize, where they have a safe place to hang out. Like kids, we get kids after school. This time of year, it's basketball season, so that gym is packed with kids playing basketball. They're playing, which is huge. Kids don't just play anymore. When you were a kid, you what did you do? You built forts. You went outside until your mom called you in for dinner. You played kick the can out in the street. Kids don't do this anymore. If there's not a coach and a snack mom and a scheduled time to go do something, they don't do it. There's no free play. So this is what we're encouraging. This is what the rec center provides. In my opinion, we're preventing a lot of things. Jack CO was in our police department for a lot of years, and we have Chief Rennick here. I think that by kids coming to the rec center, by playing, by doing these things, we're preventing them from making bad choices, from doing things they shouldn't be doing. We're providing that mental health. We're providing alternative activities for them to do. The other couple of things I wanted to mention, the mayor asked us to talk about different trends. What I see over the years of being at the rec center, we're getting a lot more older adults using the rec center, using the fitness classes. I know we have a partnership with the senior center because we both actually received some grant funding through MParks. So the senior center is bringing their seniors over to the rec center to utilize our facilities. I'm mentioning these grants, but we have a 2-year grant to do a come out and play program for kids. We used it with our Rec on the Go program last year, and we're also incorporating that model into our kids camp program this year, which means it's kind of a data-driven. We're testing kids on how fast they can run a half mile, how many sit-ups they can do. We're timing them on different things. They're playing different prescribed activities. It's a program that MParks put together, and they're throwing it out to the communities to use. And so we were given dollars to implement this program. We're also going to be implementing a walking program this summer. We got money from MParks to do that as well, along with some accessibility funding. And we also, one thing, I think we've been in contact with Jameel about a program that we offer, and we're currently offering for the next 2 years. It's called Family Functional Fitness, and it's free. Our instructor is a doctor. He offers nutritional and physical programming. It's weight loss. It's getting fit. It's staying fit. And I'll tell you what, and I'm a little bit embarrassed, but we haven't filled this program. I mean, we're getting 3 or 4 families that are doing this, and it doesn't necessarily have to be families. It can be couples. It can be an individual. It can be anyone. But we're reaching out. We're telling people about this. This is a free program. How come we're not taking advantage of it? Or how come we're not filling this? So I want one thing, if you could spread the word, have people call us. If they're interested in this, let us know. I mean, it's there, it's for the community, and we really need to get this program filled. A couple other things. I mentioned accessibility. The trend right now is non-motorized pathways. It's connecting communities. In fact, in about a half an hour, I'm going to the Saline Leadership program to talk about non-motorized pathways and what it is in Saline and where can we connect to and where can we go. I'm gonna put out another plea here. Saline, we have a non-motorized pathway plan. We created this 5 years ago. We're just about getting ready to start updating that 5-year master plan. So we're going to have some public input sessions. We want to hear from people, ideas, where we want to go, how can we get there. So we're working on Saline, but the thing is, how do we connect to our townships? How do we get to Milan? How can we ride a bike to York Township, to the neighborhoods? How can they get to us? That's what we really want. We need our townships around us to be on board with connecting communities. We need to be able to get from Saline to the border-to-border trail. If you're not familiar with that, it's a trail that you can bike, walk, run, rollerblade or whatnot from the east of Washtenaw County to the west of Washtenaw County. And from there, we want to connect to other counties. So this is the trend right now, and we need people to start talking about that. We need people to talk to Washtenaw County officials. to give us dollars to get us on the radar, essentially, so that we can get from Saline into other communities, and so that they can get to us as well. Saline is very unique. We have a lot of great things to do here, great restaurants to go to, great stores to buy things in, and we want people here. So I'm asking for your help on that today. But I think, kind of in conclusion, some of the things that I think you had mentioned, what are our deficiencies. I think one thing are our parks. We're constantly trying to keep good quality play equipment for people to go into our parks. And in fact, we have a young man, last year he was in 3rd grade, this year he's in 4th grade, and he started a campaign to put a play structure at Brecken Park, because he felt that was a need and he wanted some action. And I'll tell you what, I took the lead from a 4th grader, and we're on a mission to raise money to be able to put a play structure at Brecken Park. We've already applied for CARES for a grant. We were granted $10,000 to put towards the $3,000 that he already raised. I know he worked with Fire Chief Heff to plug it at one of the Firehouse Fridays with Bubba from W4. He got a few pledges and whatnot, but we're looking for people like this, partnerships, and it's things that our community needs. We just finished updating our recreation master plan. It was just approved by City Council at our last meeting, and this is a document that we use in order to apply for state funding, through the DNR, for Clean Michigan Initiative grants, for all sorts of other federal grants, Greenway Alliance grants and whatnot. And we had some public input sessions which were very well attended, and we appreciate the input from the community, and we're always looking for more ideas and things like that. I always have a running list of ideas or people that are willing to help, and so I do welcome anyone to contact me and let me know what we can do together, how we can provide more for the community, and that's about all I have. So hopefully that was enough information, and didn't mean to overwhelm anyone.
Thank you, Carla.
Yeah, thank you.
I would say, as a city council member, this has been very valuable to me. I've learned a lot this morning. I think we all have a sense that this is an area of the state that has an enormous wealth of resources regarding health and wellness, but I wasn't really aware at this level of detail of really how rich we are in this region. And that's really helpful to me, just as knowledge base. I think we have also a lot of potential in this room to expand cooperation and work together. I think the issues that we've touched on today aren't bound by the city boundaries. They're more regional, and I think having this more regional discussion is really, really helpful. The one thing that came up today that I want to come back to is the issue of transit that's been raised. I think that the city of Saline, if you look at the Regional Transit Authority's map of its planning for transit in the region, it's pretty stunning. The Michigan Avenue corridor comes down Michigan Avenue until it gets to Ypsilanti, and then takes a gentle right toward Ann Arbor. And Saline, which is technically on the Michigan Avenue Michigan Avenue corridor, is not part of that planning. And so I think that's been on my mind for a while. And I think today's discussion about health and wellness issues and access to health care and health services and wellness services The transit and transportation component is a really important one, especially for people aging in place. I myself have been a member of the 60 or better population for a little while now, and I think about staying in Saline if I don't want to drive at some point, or if I can't drive at some point. I want to still be able to, potentially still to be able to stay in Saline, and without good transit and transportation services, that's not possible. One of the things one of the many things I take away from today's discussion is to keep the issue and the question and planning for transit and transportation high on our radar screens. Transit and transportation isn't just the giant bus lumbering down the road stopping traffic. It can be lots of different things, and I think we have a lot of potential, but we have a long way to go on transit.
Thank you very much. There were a lot of good insights, and to echo the words of my colleagues, a lot of information that is valuable to me, I believe will ultimately be valuable to the city. There is much to think about. I'd like to combine future steps, or future needs, excuse me, and next steps, because my goal when I first facilitated and organized this forum and meeting was to get everyone out of here by 11 o'clock. And so we've got a little bit of time, but not a ton. And I'm very cognizant of your schedules and how busy you all are.
I don't know how much time you're going to have for people to respond to all this, but I have something I need to say, and I would like to say it.
Well, there'll be a second public comment period.
But if we get out, will there be enough time if you...
There'll be ample time for the second public comment period, which is enumerated on the agenda. Okay? Let me say a few things, and I want to start by echoing the sentiments of Councilwoman Tahar about transit. And I think on the transit issue, my record and my position is pretty clear. And this is an issue that we've invested a significant amount of time and energy on in recent years. I am a pretty stout advocate for expanding transit services and options in the Saline community in the years to come. And there isn't, as we know, there's not just an economic component to that, there is a healthcare and well-being component to that. And while the administrators and drivers and volunteers at People's Express do a wonderful job, one of the things that I believe this community needs to look to in the future is facilitating a relationship with AAATA, the ride, since it already provides services in Ann Arbor, in Ypsilanti Township, and now in Pittsfield. I think the future is with the ride. And when it becomes appropriate and financially feasible, I think Saline needs to strongly consider partnering with that entity. Some of the things that I wrote down, clearly there's broad consensus, and this group is cognizant of the fact that this population is going to age, and that we have to think strategically about how we meet that challenge and make sure that we provide service and amenities that are helpful to that population. The other thing that is clear to me, and I sort of chuckled, there were a number of programs and services that were discussed from the dais this morning that I was not aware of. And if the mayor of a community is not aware of some of these services and product, logic would dictate that a number of my constituents and the people that I represent are not aware of them. So one of the things I think we need to do a better job at, and one of the things we need to think about is, and this is an issue that many organizations and groups deal with, is how do we disseminate that information and let the people of the Saline community know about the services and amenities specifically related to healthcare and well-being that are available to them. So I think in the future, we need to have a focused discussion on that, a focused discussion on transit, certainly a focused discussion on providing emergency services, ideally 24 hours a day. The other thing that I would touch on, and I actually have not spoken to staff and colleagues and my colleagues about this, in particular Ms. Scruggs and her subordinates at the Parks and Rec Department. But on the issue of well-being, there are a number of communities across the nation, across the region, that have invested a significant amount of time and energy on these issues. And the one that comes to mind that I've done some research on is Oklahoma City. And I don't necessarily think of, no disrespect to Oklahoma City, I don't necessarily think of Oklahoma City or that region as being particularly innovative or progressive. But they have done a lot on the issue of wellness and healthy lifestyles. And one of the reasons why their programs have been successful is not only were they good ideas, but there was buy-in from the health community, from the private sector, and from the not-for-profit sector. So that's one thing that I want to discuss with you and some of my colleagues here at City Hall. Maybe see at a future meeting, us discuss these issues, and maybe we have something tangible to offer, and maybe there can be buy-in from this entire group. The other thing that I would touch on last, and of course Dr. Nagpal spoke to this, and I don't know if Chief Rennick did or not, but Chief Rennick is the co-chair, along with Dr. Nagpal, of our Substance Abuse Coalition. And many people at this table, including St. Joe Hospital, have been very supportive. That group has been reactivated, and I'm hoping that in the coming months they do some pretty serious and substantive things to help to educate our population on the dangers of substance abuse and addiction. Because substance abuse and addiction, as we all know, are just devastating and debilitating to a community, and it can't be tolerated. And I think it's incumbent upon those of us in leadership positions to do something about it. So that was a bit long-winded, somewhat protracted. There's a number of things we need to continue to touch on. I hope you all found value to this meeting. What I would like to propose, if you are amenable to this, and it's not going to happen overnight or in the next month, but I'd like to reconvene this group again, also trying to get some local physicians and specialists. I want to personally thank Supervisor Stanowski for joining me this morning, because this isn't just about the city of Saline, it's about the entire Saline community. So in addition to Supervisor Stanowski, I will again reach out to my neighbors in Pittsfield, in Saline, and Lodi townships to make sure that there's regional representation at the table. But my proposal is that my office work to facilitate another meeting sometime in probably late spring. I'm thinking the end of April, beginning of May. And we're happy to host it again here at City Hall and Council Chambers if this was convenient for everyone. Does this time of day seem to work? I don't want any more evening meetings, so that's kind of a selfish thing, but seems to be okay? Okay, all right, very good. And the other thing that when I will certainly be reaching out to all of you to identify some dates, but as I mentioned when this particular meeting was facilitated and organized, if there are interested parties, organizations that you think should be at the table contributing and participating, feel free to extend an invite or reach out to my office and I will extend an invite. Because this is meant to be a very inclusive effort. So, make sense? Okay, very good. Anything else from the dais this morning? Yes, Michelle.
My only comment is this is a really bad time for physicians, but.
Okay. What would you propose?
I don't know. I think that depending on the physicians that you're looking to have a conversation with, speak with the, I'd ask them.
Okay.
I mean, somebody like Linda Spiegel, who you've mentioned before, is an advisor to the council on healthcare, is in practice at this time, and most of the physicians in this community are in practice during the day.
Do you think there's value in maybe proposing an earlier start time, like 8 o'clock?
We meet with our physicians at 7 a.m. I know that's
Whoa.
that's a difficult time for this audience, but I either that or have them represent their voice in some other way, or ask them how they can certainly contribute to this effort.
Councilman Seo proposed maybe a weekend date. I'm not sure that would work with everyone's schedule, but I guess what I will do is I will try and identify a variety of dates and times.
Or again, speak with them to see how
Correct.
their voice could be part of this.
Okay.
Thank you.
Very good. Anything else from the dais then? Appreciate your times and insights very much. Referring back to the agenda, and again, we would invite anybody who wishes to make public comment to go to the podium where you can use either one of the 2 mics that are provided. We will entertain comments from the public at this time. Comments will be limited to 3 minutes per person. Anyone who would like to speak is requested but not required to state his or her name and address for the record. Are there any citizen comments? Please.
My name is Gail Robinette. I've lived in Saline since 1953. My parents moved me here from Ypsilanti, and we did have a hospital here in Saline at that time. I'll be brief, but I'm really up here because I don't want other people to have to go through what I went through here the middle of the month. On the 15th of January, I was operated on for a kidney stone in Chelsea, and they did a real good job. I was released from the hospital, came home, and in the afternoon, I had urinary tract problems, and I chose to go back to Chelsea, and I'll explain why later. They inserted a catheter, and I came home, and at 10:30 that night, I had to go back to Chelsea again on an emergency basis because the catheter failed. On Monday, my catheter was removed by my doctor, and Monday night, I ended up having to go back to the emergency room in Chelsea because I couldn't urinate. And the catheter was put back in. And I chose to do that because I didn't know, number one, what hours the urgent care system was open. I had a friend who went there one day in an emergency, and it was closed, so he had to go to St. Joe. Number two, I went to Chelsea because of my perceived issue about traffic. I felt like I'd get to Chelsea quicker than I could St. Joe. And my wife was driving me, so that's the way we went. I didn't call the fire department because I didn't know whether they could insert a catheter. I didn't know what they could do, and I had no idea about the ambulance situation. So my feeling is, I don't know about everybody else here, but we were never given a lot of information when St. Joe decided to close their emergency room. We had nowhere to go. We didn't know what was going on. We didn't know what to do. So I'm kind of concerned about that. I ended up going to St. Joe in Chelsea, and I ended up with 4 times as much material in my bladder that I should have had. I'm just at a loss. I didn't know we don't know what to do. And I hope nobody else has to go through that. So I wish we could have an emergency room back in Saline. I really do. Thank you.
Appreciate your comments. Thank you for your attendance. Are there additional public comments? Well, let me say a couple things. Again, thank you all for your attendance. I believe that some of our stakeholders will stick around for a little bit if there are people from the audience who would like to connect with them and ask questions. It sounds like there are some concerns and some information that the folks from St. Joe can disseminate to the group that might be helpful. We do still have some coffee, fruit. It's not lost on me the irony of providing donuts at a health and wellness forum. And there's some fruit. But you're welcome to help yourself to anything and everything that we've provided. Again, for those of you who are in the audience and who are interested in these issues, I'm happy to meet and discuss any issue involving community health and wellness at any time. Just contact my office. More importantly, I would encourage you to sign in and provide us your address and your email and phone number if you have it, so that we can contact you when a future meeting is scheduled. And I'll also note that when a future meeting and forum is scheduled, we will also provide a media release to the Saline Post, the Sun-Times, the Ann Arbor paper, and the Saline Eagle in the hope that they will help us disseminate that information. Again, is there anything else from the dais this morning? No? Well, I appreciate your time very much. Thank you all, and have a wonderful afternoon. This meeting is adjourned.